and that's the census. The census April 1st. We've spent a lot of time talking about the coronavirus, but the other big C is the census. So please, the day is April the 1st, and um, most people probably have gotten some mail about from the census with your access code where you can go online and respond to the census. Let me encourage everyone, especially while you're at home or if you're at your business, essential business, if you will go online today, if you'll go online today and respond to the census. We need to get up the numbers in Houston, Harris County. And again, everyone is eligible to fill out the census. Everyone, regardless of where you come from, whether you are documented or undocumented. You know, you do not have to be a United States citizen, but if you are living in the city of Houston, if you are living in the city of Houston, you can, and we want you to fill out the census. This has nothing to do with ICE. This is not sharing your information with ICE. This is about pulling down the resources from the federal government for our healthcare delivery system, college university grants, transportation, streets, roads, parks, libraries, redistricting, purposes. So please, please, let me employ every Houstonian and every person within this, that's listening to me today. If you will go online, it takes about 2 to 3 minutes, and you're done. 2 to 3 minutes. I think it's about 9 questions. You simply fill that out, and it's our obligation to be able to count every single person that lives within the city of Houston. If you are living, we just need to know that. So please, please, please fill out the census. Having said that, today at City Council, we pulled $5 million from our economic stabilization fund to set up a special COVID-19 account. That's very, very important. Today on City Council, I want to thank the members of City Council today. In fact, I'm standing here with Councilmember Edward Pollard. I want to thank the members of City Council for agreeing to lease 2 hotels, 186 rooms for those 2 hotels to be used as quarantine space. It is a 3-month lease agreement. And then there's a third hotel that is also currently being used, and we'll solidify that agreement next week, that is being used now in the downtown area, and is being used primarily right now by firefighters and police officers. All of these hotels will have the same sort of lease agreement. We'll be paying the same, and if additional hotel space is needed, then we'll enter into additional agreements for the same lease terms. The additional inventory will allow the city to house not only first responders, but also municipal workers and homeless individuals as well. And then we'll segregate them, because one person was asking, are we mixing the two? No, today was 2 hotels. We can use one for, let's say, for our homeless population, one for first responders, other municipal employees that need to be quarantined. And then this is a collaborative agreement with the Harris County, and we are leasing the facilities. Harris County will be responsible for providing the ancillary services, food, medical care, treatment, security for these 2 hotels. And I think they have already approved part of the measures that's needed on that. So I want to thank the county for work. Well, we're working with one another. So these facilities can also be used by Harris County as well. If someone is waiting on test results or tested positive, and if they have nowhere else to go, they can use these rooms. And the room cost is about $200 daily, which is when you factor in all of the cost, meals, security, and we believe all of this will be FEMA reimbursable. Let me also say, and we've gotten raised some concerns about people, for example, in many of our parks, playing basketball and things of that nature, drawing big crowds. And we're taking steps to alleviate that, because the whole notion now, we're continuing to be on the order for the next 30 days until April the 30th, and social distancing is very important. And it's one thing to play tennis, you'll cross the net. but in regards to basketball, that is a physical contact sport. And so on Monday, I ordered the Houston Parks and Recreation Department to remove basketball rims and goals to help better enforce social distancing. Hated to do it, but health first. And what you will see if you look at the numbers, the population that's coming back testing positively is that age group between 20 and 60, and a lot of it is in their 20s and 30s, so to speak. Not to say that older guys like me don't play, but we can't get up there and duck as much. And so we are removing the rim and goals, leveling the playing field, so to speak. But it is being done to keep people healthy and safe, okay? That's the reason why we are doing it. And there are 492 goals located throughout 142 parks. And yesterday, the team removed or secured 89, and we'll be working to secure the others as well. In addition, 1,200 signs have been deployed throughout the parks system, 800 in English and 400 in Spanish. And the park monitors will begin daily rotations to assist in reminding constituents to observe all posted rules and practice social distancing. The parks remain open, but if they become so crowded or where people are not engaging in social distancing, then we will be monitoring that situation, and we reserve the right to tell people to move on, and we reserve the right to simply to temporarily close those parks. We did one over the weekend where it was just so many people in the park could not engage in social distancing, and so we told people you're just going to have to disperse. So let me just ask people as you go to the parks, if you see that the parks are already just full, crowded, go to another one. There are other parks, or feel free, you can still walk within your neighborhood. You can do that. Last week, the parks team distributed 6,000 prepackaged meals at 50 park sites, curb sites, and Monday and Tuesday of this week, the team has distributed 3,000 prepackaged meals, and daily monitoring and social distancing is also occurring. And to the extent we need to do more, we will do just that. And then let me just say, the numbers, we're doing more testing. The second Houston testing site is now up and running with a maximum of 250 tests per site. And then that there's other testing that's taking place in the city of Houston with other either nonprofits or private medical services that's being provided. Testing is very important and to give us some sense of what's taking place in the city of Houston. And so let me just say, as of this morning, the number is 377. With more testing being done, the numbers are going to go up. So let me just say that. The numbers are going to go up. And then because the testing has been done by different units, different components, as we gather that information and feed it into our system, and then when it comes time to post those numbers, the numbers, you could go from 377 to 450. Let me just use that. You can go from 377 to 450 because all of the numbers are coming in because there are different groups that are doing testing. Harris County, City of Houston, we are doing testing. But Legacy and other hospitals are doing testing. They're sending their testings through LabQuest and what's the other one? LabCorp and Quest. And those numbers are going up to FEMA, for example, or CDC. And then we don't know whether or not there's a backlog in their reporting. And so by the time those numbers come back to us, the numbers can go up. But I do want to underscore this. What we are doing in the city of Houston, in Harris County, in our region. What we are doing is working. So let me just say that. I know people are making huge sacrifice, but I want you to know that what we are doing with the stay home, work safe, social distancing, washing your hands, using sanitizer, spacing yourself out, those practices are working. And when you look at other cities, whether it is other states, whether it's in Louisiana, New Orleans, for example, New York City, California, LA, Washington, when you look at other cities, and where we are today, we have taken significant steps in order to flatten the curve. And that's the goal, to flatten the curve such that our healthcare delivery system is not overwhelmed. As Dr. Peter Hotez from Baylor College of Medicine said on yesterday, he anticipates the peak for Texas to be right around May the 2nd. So let's continue to work together collectively, and we can get it done. And then this is April 1st. I'm asking landlords and tenants to work together, okay? Please, 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 don't be throwing people out. This is not the right time to do that. So let the landlords, my hope is the landlords and tenants will work together. And then the grocery retailers wanted me to remind everyone there's no question, there's no problem with the food supply chain. So this is the first. A lot of people are getting, checks and other things in the mail. You don't feel like you don't have to just go and rush and buy everything. So please don't do that. Buy what you need and then be respectful of others who have to do the same. So if you do that and engage in social distancing while you're in the stores. Let me stop there. And Dr. Peirce, anything you would like to add? Or do you want to?
Thank you, Mayor. So there's a couple of things. One is that the Mayor touched on, which I think is important about the numbers, is that we would like for it to be a nice, steady, predictable change, and that's not going to happen, unfortunately, because, as you pointed out, so some of the commercial labs, the federal government, for example, with the testing sites, has engaged some of the national large commercial labs, and they're taking a priority, which means some of the other labs in the community are looking at very long delays in getting their answers back, up to as much as 2 weeks in some cases. We believe, we understand, we're led to believe that they are at least notifying the patients promptly, but in terms of the local health department, they're gathering those up and sending them to us perhaps once a week, perhaps once every 10 days. And that makes the numbers very appearing to be unsteady. But what we need to understand is that the growth of the virus, the spread of the virus in the community is entirely dependent on the behavior of the people in that community. And so as the mayor has repeatedly pointed out, the importance of social distancing, do not be distracted by the numbers, recognize that the numbers are going up, and what that needs to tell you is that the virus is continuing to spread. And the key to that, the thing which will slow the virus down, is our social distancing efforts. And so, as painful as it is for all the things that the mayor and the judge have had to do, these are really important steps that we need to take. The government can only do so much. We're really looking, the hospitals, we met with the hospitals yesterday, and they were at the press conference. They have told us that for now, for the moment, there remains capacity in the hospital. So today, if somebody is ill, there is a hospital bed available for them. But we all need to work hard to make sure that we don't overwhelm the hospital system. And the hospital system is going to need to expand as well, and there are plans to do that. But this is a community-wide effort, and I just want to echo everything that the mayor said about that. Don't get distracted by the numbers. Focus on the message.
And please bear in mind, and I forgot to acknowledge Mayor Pro Tem Martin for being here. I want to thank him because he's been pitching in and standing in for conferences and meetings when I've not been able to attend. So thank you so very, very much, Mayor Pro Tem Martin. The other thing I want to say is that even with regards to people who have been testing positively, most of them, the largest majority of them, are self-resolving themselves at home and not in our hospital systems. And so, and then I want to emphasize again, because I keep hearing these different reports, people who may be traveling, for example, going to California, coming back. If you leave the state of Texas, I know we've been talking about a lot of people who are coming to the state of Texas. But let me talk about people who are, let's say, Houstonians who are traveling outside and then coming back. If you leave the state of Texas, whether you're an employee or not, I'm asking you to self-quarantine for 14 days when you come back, because we're getting reports of people who have gone, for example, to California and come back, and then are coming down with symptoms. And then let me say, if you are experiencing, if you are sick, you stay home. And not only if you're sick, stay home, but don't be traveling around in the neighborhood and attending, with your family members and friends. Please do not do that. The other thing, if you are being tested, let's say you have gone and gotten tested, and you have not gotten your results back, don't go and get tested and then go back to an essential employer or be walking around and going around the community. You've been, you had the symptoms, you went and got tested, and you're waiting for the test results. You need to quarantine yourself and not be walking around and exposing others. So let's not do that, okay? And then with regards to the PPEs, Chief Bunick, you want to provide us with an assessment?
Yes, sir. Thank you, Mayor. Thank you for your leadership. Regarding the PPEs, on Monday, we received a shipment from the federal stockpile to support the testing centers, and that was another reason why we were able to open Del Mar Stadium this afternoon. Additionally, SetTrack made a distribution to the Houston Fire Department out of the state stockpile. And then lastly, on the donation side, the city has been fortunate enough to receive donations from companies like Home Depot, Lowe's, Shell Oil is going to donate some gas, and then the Asian community, Chinese community from the University Alumni Association through Representative Jean Wu was able to give us a donation of PPE. And then lastly, Houston Texans long snapper John Weeks, he donated 100 meals to our hardworking employees that are based out of our Houston Emergency Center. So we're always talking about the first responders, but the employees of the Houston Emergency Center, the 911 telecommunicators, the call takers, the Houston Police Department dispatchers, the Fire Department dispatchers, and then all the support personnel, whether it's the maintenance or the IT people that make that facility running 24 hours 7. They're really the kind of behind-the-scenes people that are really making the city work, and it's a place that we can't close. So we really appreciate all the donations that we receive. Thank you, Mayor.
Certainly want to appreciate that. And with respect to PPEs, in addition to that being donated, we have taken the steps to purchase another 180,000 KN95 masks. We're purchasing another 40,000 gowns, some additional goggles. So we are continuing to purchase and to make sure that our first responders and city employees have what they need, and we'll continue to make those purchases. So we appreciate people who are stepping forth and assisting, because we're going to be in this for we know the next 4 to 6 weeks. So that's going to be critically important. Chief Pena, anything with respect to the fire department? Any additional cases beyond what was reported yesterday?
Sure. Thank you, Mayor. So first of all, I want to echo what's been said up here as far as personal protective equipment. The Houston Fire Department and Police Department have a healthy supply of that equipment. We haven't had an incident where we haven't been able to deploy this equipment to our personnel to do their jobs. In regards to our personnel, we did have an uptick in the people quarantined. We're taking a very conservative approach to who we quarantine, again, because of all the stuff that's been talked up here. We don't want to be the cause of any spread and further that issue. So we're taking a very cautious approach, a very conservative approach with our personnel when we put them into quarantine. We have about 176, and we did have an uptick in the number of positive coronavirus cases for the fire department. We're at 12, and it's just like the mayor and Dr. Peirce have mentioned up here, is that there is a slight delay in the reporting. So one thing that I want to make clear is that for the Houston Fire Department and the Police Department, any of our first responders that require testing, that meet the qualifications and the criteria for testing, have been able to get testing. Okay? There is no issue with us being able to access the testing and getting those reports back. So, thank you.
Okay, so based on the numbers that I've been received, that I've gotten as of now, firefighters in terms of tested positively 12, police officers, I believe that number is 12, unless that number has changed since yesterday. And with respect to our municipal workers, that number is 18, and I will say to you that most of them are in our public works department, people that are out there that are supporting everyone else. So that's where we are. I'll stop, and we can take any questions you may have.
Mayor, just some questions from different folks here. From KHOU, they want to know if, besides Kendrick Hospital, where else you're looking to potentially house hospital overflow patients for COVID?
And we're looking at in different quadrants of the city. Any facility that was a hospital, of course, is certainly on the list. And I think there are 2 or 3 of those that we're looking at, former facilities that were hospitals that still have all of the, pretty much the connections in place, or may need to be rehabbed. But then we pass those over to the Texas Medical Center, and then they take it from there. So we're identifying possible facilities, turning it over to the Texas Medical Center and to those hospitals. They are the ones who will be responsible for operating them.
Are your quarantine rooms available now? I think 186 rooms, and how long is the lease for?
It's a 3-month lease, and we are ready to go as of now, today, yes.
And I think several media outlets had asked about the $5 million.
Yes.
How are you planning to use it? Are they for large purchases only, for everything in between? Like, how are you going to use that?
We pulled the $5 million from the Economic Stabilization Fund and placed it into the COVID-19 account. So anything that's COVID-19 related will be how those dollars can be used, and we believe all of those dollars will be reimbursable from FEMA.
The Chronicle wants to know if, do you agree with Chief Acevedo on the compassionate release at the jail is a bad idea? Has the city considered reopening the Makawa jail?
I have not seen the order that the county put forth on their compassionate release. Certainly that falls within the purview of the county and the county sheriff. And I can't think of Dr. Porsche, is it Porsche? Dr. Porser. And so I have not reviewed it, and they've not sat down and talked with me about it into any detail. So I respect their right to take the initiatives that they think are needed in order to protect the people in the jail.
How do you feel about it overall in the city of Houston?
I think we're all having to make very tough and very difficult decisions. They certainly are privy to their numbers and the configuration of the jail and how many people, for example, are in a cell, or how many in the overall, how many are compartmentalized, how close they are. In terms of, I know there's one person who tested positively and many others that were having to be quarantined. We're all concerned, for example, about people that are in a large, grouped in a large setting, because one person that is exposed with a confirmed case can spread very quickly. On the flip side, for example, I'm concerned about our homeless population that are in shelters, and we're working to spread them out and working with our faith-based institutions. But I respect the right of the county people to make a decision that they believe is in the best interest of the county and the general public as a whole.
The Texas Tribune would like to know how big the crisis will have on the city's budget. I know you talked about it a little bit yesterday, but
Yes.
Do you have any specific projections? Do you agree with, I guess, the controller's estimate that we might be down $300 million and things like that?
I think it's way too soon to make those sort of analysis, and I think he was assuming the very worst case scenario. No one knows, for example, whether this situation is going to last in May, June, July. You just don't know. The situation is so fluid. When Dr. Peter Hotez indicated yesterday morning that the peak in Texas would be May the 2nd, then the question is, assuming that's correct, and if we all engage in social distancing, how long will we be in it? Now, we're not going to just, open up overnight, so to speak, so it'll be a phase in, but our fiscal year ends the end of June. We start another fiscal year for July 1. The budget that we will be putting in place will be for July 1 through the following year. We've been working on it for 12 months. We just didn't start. It's a very conservative budget, and I have a sense on how we need to proceed and how we will balance. And lastly, let me just say, when I came into office in 2016, and certainly Mayor Pro Tem Martin can attest to this, the elephant in the room in 2016 was pensions. And it was at a crisis state, and the cost was rising like that. That was in 2016, $160 million shortfall, and we balanced the books. Every year since, we've had to balance the books with coming in with a budgetary deficit. The elephant in the room this year will be the coronavirus, COVID-19. And we'll simply have to make the tough decisions like everybody else is making tough decisions. And then lastly, talk with Bill Kelly, my government relations team, and I know Congress is looking at a possible another stimulus bill that will assist municipalities. I was on a conference call with the executive committee of the U.S. Conference of Mayors. I'm a trustee, part of that executive committee. And we all are working with the congressional leadership to see whether or not they will pass another stimulus package that will go, part go directly to cities to assist cities that are losing revenue as a result of COVID-19. So there are a lot of moving parts, and we'll work it through.
And as far as the governor's order from yesterday, have you guys had a chance to digest it? Do you believe any sort of, are there going to be obvious differences for Houstonians to see moving forward? I think specifically, do you expect churches to just, some churches to say, come on down this weekend? I mean, sort of.
I hope not.
But that does eliminate that part, right? So.
Well, the faith-based community has been working very well with the rest of us. We're all on the same team. We're all on the same team. And the members, for example, of faith-based institutions are employers, employees, their parents, their children. So we're all on the same team. I want to thank the faith-based community for how they're working with the rest of us. We're all in this together. Most of them have gone to online streaming, my church included, and I appreciate them, and I'm very grateful to them. This is not the time to change course when you're still in the midst of the storm. So, and I think the faith-based community can understand this analogy. When you're in the midst of the storm, you don't go back. You keep going through. Because in order to come out of it, you got to go through it. And I know the faith-based community understands that. So, I shouldn't have to tell you that if there's a building on fire, don't go into the building. And I don't care who tells you to go into the building. If the building is on fire, so to speak, if I tell you to go into the building and you go into the building, now, stop. And what we're saying, if you're engaging in socializing, hugging, hand clapping, sitting next to one another, then you're putting yourself in harm's way. I don't care who tells you to go in there. Exercise some common sense. And I think the faith-based community understands that. And again, I want to thank them for their prayers. But what I do know, and long story short, because I know it's a very sensitive topic, let's do what we can do. Our faith will carry us the rest of the way. So let's exercise some common sense and judgment.
Can Dr. Peirce answer a few testing questions?
Yeah, this is not about me.
And all the channel. Sure, two. I was going to have him ask them, just testing. So can you give us a sense on the city sites and the county sites about are the turnaround times still 4 days or 10 days? Because Legacy is saying they're 10 to 14 days.
Right.
Yeah.
So this is a little bit of what I touched on earlier, is the turnaround at the commercial labs, because the federal government and at the testing sites, the city and the county testing sites, they're really FEMA supported, and so that's a federal contract with the laboratory that's doing it. And so you're right. My understanding is that for places like Legacy and other private entities that are testing and using those same labs, that their turnaround time is becoming very, very long. And as I said, we believe, we hope, we trust that the labs are at least contacting the individuals who are tested and letting them know promptly. But in terms of reporting back to the clinic or to the local public health department, we're seeing some very, very long lags. And I think to your point, it appears, my understanding is that the those huge labs at the federal government, Quest Labs and LabCorp in particular, are prioritizing the samples taken from the city and county sites. Remember, we're not the only city with this. There's about 40 cities across the nation involved in that. My understanding is that those tests are being prioritized over the private contractors, the legacy clinics of the world.
So the city, county, what's your time frame right now? The people who do
Yeah,
you call the health department, you go to Del Mar, what's the time frame for that?
So we're getting reports, actually today we're expecting a large report from Quest Labs. This will be the first time since they started taking the samples from our sites. So that's almost 2 weeks, I'm thinking, for them to get the reports to us. Again, what we understand is that they're notifying the patients promptly, but right, the quest is notifying the patient of the positive results, but they're not getting it to us until later.
That's like 48 hours or 2 days for?
So if you went through one of the sites, you were handed a piece of paper and you were told that you would either get a call, this may be not exactly my recollection, you'd either get a call from them within 3 to 4 days, or there was a website you could go to, and each individual had a unique identifier, and you could put that into their webpage to get your result. If you didn't get a call from them, that was supposed to be within 4 days of the test.
And then can you address the fact, I just have two sort of other testing related. Do you don't want to do the testing all with once? Okay, I was just going to ask.
Can I say one thing about testing that I've said other times? I think it's really important that people, and I ask the media to repeat this and get this out, and it goes back to something that the mayor said. If you should go and get tested, let's say I go on a Monday and I'm worried and I've got some symptoms, and I get tested on Monday, I may not receive the answer to that test result until, say, Thursday, 4 days later. And let's say the test comes back negative. Okay, so I was symptomatic, I went and I got tested, and it came back and it was negative. Maybe it was my allergies or whatever. That does not provide you any level of protection that you won't get infected on Friday. So I hear a lot of people saying, I need to get tested so that I won't catch the virus. Those are two completely separate things, and I hear a lot of people making that confusion. So if you got tested and the test comes back negative, that does not mean it's okay to go and gather in large groups. You have no level of protection because you tested negative. It just means on a Monday, you didn't have it. You could have got it on Tuesday.
Have you seen any of the purported 10-minute, 5-minute, 40-minute
Yeah.
private? Have you seen that anywhere in Houston?
I've not seen that yet, but that's another confusion point. So Abbott Labs, which makes a lot of testing material, has come out with 2 new devices. They are both 5-minute or 15-minute devices. One of them actually tests for the virus, which is a test very similar to what we're doing now. It tests to see if you actually have live virus in your nose, okay? And they're able to do that pretty quickly. They are also have come up with another very quick test, a 5 to 10-minute test, as have many other manufacturers that test for immunoglobulins. So this is testing for the virus. These are testing for the immunoglobulins. The immunoglobulins is your immune system's reaction to the virus. So this doesn't tell you whether or not you are currently infected. This tells you whether you were infected. So this is a good way in the future for us to identify people who were infected and now have some immunity. But again, because they're both 5-minute tests, I fear that there's going to be a lot of confusion as to what those tests are telling you. So that's a good question. Thank you.
Good morning. Hope everyone's doing well up there. Mayor, quick question, sir, if you don't mind. Good morning, Mayor.
Yes.
It was touched on it briefly, and I know from watching Sunday's video when you were inside the Kindred Hospital, you had indicated, sir, that you really are trying to secure as many rooms as possible because there is going to be a need eventually by everyone's estimations here. One hospital that we identified was Bel Air, the old Bel Air Hospital in Bel Air off of Dashwood. People that we have spoken to, they're looking to go into that hospital to help turn it into a COVID-19 hospital for COVID patients. We looked at emails from the landlord, and the landlord said that they want no COVID patients inside of that facility in terms of making a lease happen. What do you say to that, sir?
Well, this is the time when we all need to work together. We are in this shared sacrifice on everyone's part. And I hope that people will assume that attitude. I will tell you, if we need the space, we need the space. If we get to that point, hopefully we won't, and hopefully people will work together in concert, and we can blunt the progression of this virus. But if it gets to the point that we need additional hospital capacity, just like in other jurisdictions, we're all in this army. And quite frankly, it's not like a voluntary draft. I mean, this virus is not asking for permission. So we're all in it, and I hope that we'll all will be willing to engage in shared sacrifice. There are a lot of people that are hurting right now, financially, tenants, landlords, small, medium-sized businesses, large businesses. We're all hurting. So, I hope, hopefully, as people think through the implications, that everyone will take a very responsible approach and recognizing that if we work together, the quicker we can get out of it and we can get back to our normal course of existence. So hopefully, even they will rethink their position.
Can the city take the avenue, if need be, to say, listen, we need this, we're going to use this?
If you're asking whether or not we can at some point, and the answer is yes. And we'll take whatever we'll take the necessary steps to meet the health and human service needs of the people in the city. But hopefully we'll all work together, and I think we will.
Question for Chief Peña in Spanish. Jefe Peña, si me podría decir sobre el número de bomberos en cuarentena e infectados aumentó ayer, ¿no? Bastante.
Sí, mire, el número de bomberos que tenemos en la cuarentena son 176, a pesar a partir de esta mañana, y tenemos 12 que han sido positivos por el coronavirus. Todos están recuperando en casa, ni uno ha sido hospitalizado, y esperamos que recupere pronto.
Sobre los hoteles, ¿alguno de estos bomberos en cuarentena van a moverse a esos hoteles que acaba de rentar la ciudad de Houston?
Mire, los hoteles están disponibles para los bomberos y los policías a este momento. Preferimos que si están en cuarentena que se mantengan en casa, porque ahí es la recomendación del CDC y de otras asociaciones, que es mejor servir la cuarentena en casa. Pero si hay personas que no puedan mantener esa cuarentena y esa seguridad en casa, entonces la ciudad de Houston tiene habitaciones en hoteles que podamos poner a los bomberos. En este momento tenemos 22 en el hotel, y se me hace que el departamento de policías tiene otros 2 en los hoteles.
¿Le preocupa la razón de que no se divida a personas sin hogar y a bomberos y policías? O sea, que si tenga un hotel separado, ¿es lo que pide usted?
Sí, es lo que está en pie a este momento. Son 2 hoteles diferentes. Uno es para los miembros de primeros asilos, los policías o bomberos o los paramédicos, y el otro es para las personas, el público en general.
Mayor, what I ask him is so for sure we're going to have a hotel for homeless.
Yes, I understood.
Yes, and one for first responders. How we decide which one goes to who?
Well, we've got today was 186 rooms total. We can place, for example, for the homeless, we can put them in one for right now, and we can put municipal employees and others in another, those who need to be quarantined. In fact, we're utilizing 3 hotels, police and fire. They're utilizing another hotel, and we will continue to utilize that, and we'll codify that next week with members of City Council. So we want to pull together enough inventory that we can kind of group people where they need to be appropriately. Nada para mí en español.
That's it.
And such a way I said nothing for me in Spanish. Okay,
No,
Okay.
español.
Who's next?
Mayor, with regards to the revenue that's coming in and projects that are going on around the city, we understand there's a challenge there, there's no doubt. Can you speak to the issues with airport travel that we're seeing overall right now and the future when this is done, and how the PFC charges that are taken with regard to passenger travel, how that might impact, let's say, projects like iTrip out at the airport, and separately, are any projects that rely on that funding right now being placed on hold for the time being?
Let me just say the airport system has done a pretty good job at establishing a meaningful reserve. I want to say their reserve was about $500 million, I think I'm about right. So they've done a pretty good job at establishing a meaningful reserve. What will happen, we all know that the airlines are going to benefit, significantly from the stimulus package. And at some point in time, we're going to get back to normal operations, and we'll start to ramp back up. How long that will, when that will be, no one really knows right now, but that's the anticipation. And then as the projects proceed, just like with us on the municipal side of City of Houston, if projects need to be delayed, deferred, depending on how long we're in this crisis state, then I'm sure those projects will take place. Just like on the CIP on our side, if we have to slow down those projects, we'll slow them down. Airport has its own CIP projects as well. If they have to slow things down and wait until we get back to a normal course of business, they'll do that as well.
And a quick follow, has that action already taken place, sir? Have some projects been slowed down at all?
At this point in time, I've not been notified that projects have been slowed down. I have certainly reviewed the CIP for the airports, like I've reviewed CIP for the rest of the city of Houston, and we're just taking it one step at a time. We're not going to just be eager to move forward. Many of those projects are supported by bonds, for example, so we'll have to wait and see what the bonding market will be. But I will give special credit to the airport. They've been very diligent in how they have proceeded. They have a healthy reserve, so they're in better shape to withstand many of this downfall than, quite frankly, other parts of the city of Houston.
I just for Dr. Peirce again, sorry we have so many testing-related questions. How many people do you have, do you know, the recovery? And then are those people having to take like a separate test that takes another 2 weeks to get back, sort of thing?
Yeah, this is another good question. I'm really glad you asked. There's two ways for people to meet the definition of having recovered. One is that they would, and we learned about this, but the public learned about this from the San Antonio case, where after symptoms have resolved, somebody can be tested, and they have to have 2 negative tests separated by at least 24 hours. And that goes back to the story of the case in San Antonio. I think that's where the media or the public first learned of it. So that's the testing route. The other route is a clinical route, where you go by the patient's signs and symptoms. And so anyone who has been ill and say they tested positive, and then their fever goes away without any fever-reducing medications, so no Tylenol, no ibuprofen, no Motrin, none of that, no fever-reducing agents, no fever for 3 days. And during that 3 days, they can continue to have some respiratory symptoms, but they need to be improving. And then by the end of that 3rd day, that needs to be at least 7 days from when it began. So that's the clinical way, and that's the way the vast majority of people are going to meet the term of having recovered. And part of the reason is that the testing remains a very precious resource. So we want to use that on identifying new cases as opposed to spending now 2 more tests on people to determine whether or not they were recovered. And so this is an important question. I'm glad you asked, because we're getting a lot of employers whose employees were diagnosed positive, were ill, and are now feeling much better, and they're demanding that their employee have 2 tests before they can come back to work. And that's just unrealistic, and that is not helpful to the community, because we need those tests to test people who have not yet, that are potentially currently infected. We don't need to be using those on people who would easily meet the clinical definition of having recovered. So that's a great question. Thanks for asking.
So are you telling the employers, or would you like to tell them, like, they need to go to the doctor and have not a fever for 3 days, whatever the protocol you told them?
So I'm not going to tell employers how to write their policies. I would say that the CDC criteria is pretty widely accepted in the medical community, and and part of it is objective. Somebody can take their temperature and show that the temperature is normal, but the rest of it, quite honestly, is a little bit of math and counting days, and also the subject of how the patient feels. And so how employers want to take that and operationalize it for their work environment is up to them, but those are the criteria that are being promulgated.
And just one last thing, you had mentioned it before, but the city of Houston still has, internally, you have like 60 tests available a day?
Yeah,
And you use that for what, first responders? You use it for medical doctors? I mean, that's
city's-
not available through the drive-through, but.
The city lab does 2 runs a day, and that gets us 58 samples that we can do. But we are the public health lab for a 17-county region. And there are other similar labs across the rest of the state, in fact, across the nation. It's part of a national network. So we are predominantly using tests on patients who are hospitalized and are critically ill in hospitals. They can't get the testing done any other way. That's our primary mission right now, is to support all the other counties, because we do have the support with the federal government right now with the big testing sites. We do have a lot of places like Legacy Clinic and others that are helping us out with testing. And so we're trying to maintain that for its primary mission, is to support the 17-county region.
Don't forget the census, the census.
And you will be out at a Census Bureau this afternoon to talk more about the census. I think you already gave me advisory.
Thank you all.